Well, certainly the most common one, the one that almost everybody has, at least sometime during the year, are what are called tension-type headaches. And paradoxically, even though almost everyone has them and knows what they are, we know them and we have them, we know them when they see them, they're the ones that are least well understood. They have nothing to do with tension. They've had many names in the past: psychogenic headache, muscle contraction headache. It's the headache that usually isn't disabling, but it's nagging. It's usually on both sides of the head, and people will say it feels like a vice or there's pressure. It's usually not associated with nausea. It's usually not associated with vomiting. People, instead of laying down in a dark, quiet room, are usually active. In fact, it's often better if they get up and about their business. Some of these people even relieve their headache by going out and walking or running. For patients with tension-type headache, there can be two general patterns. One is episodic, which usually means they have it less than half the month, and it can be very infrequent or relatively frequent. And there's chronic tension-type headache, which can occur more than half the month, and for many people, maybe almost daily or daily, and sometimes even constant. And some of these patients, instead of having mild headache, actually will be more moderate in severity. Many of these people, in my experience, are older patients over the age of 50.
The most common treatments for episodic tension-type headache include over-the-counter, non-prescription pain relievers like acetaminophen, aspirin, ibuprofen, and naproxen sodium. In some cases, treatments other than drugs are effective. Examples include acupuncture, chiropractic manipulation, physical therapy, exercise, and relaxation techniques. For chronic tension-type headache, alternative treatments are often used to avoid the overuse of standard pain relievers. These include tricyclic antidepressants such as amitriptyline and sometimes biofeedback, which can be helpful for tension-type headache in some people.